Define traumatic asphyxia, autopsy appearance, add a note on medical legal aspect. Traumatic asphyxia or crush asphyxia, name suggests form of asphyxia resulting from trauma to the chest or external pressure on the chest, abdomen, back, which prevent normal respiratory movement. It due to pressure on the chest from unconcerted movements of person in a crowd, stampede, non-penetrating trauma from being pinned down by a car in a motor vehicle mechanics, loss of space within a vehicle when it is compressed or collapsed in a road traffic accident, house collapse, the commonest form of accidental death from traumatic asphyxia in farm workers is the overturn of a tractor. In trench workers, the fall of earth from a ill-prepared trenches with a sufficient force to prevent effective breathing movement. Restraints of a suspect by hog tying as practiced in some states in USA by the police has occasionally resulted in sudden death due to positional asphyxia. The victim is handcuffed with the hand being with his back with or without binding of the ankles to the handcuff. The restraint inhibits breathing, especially as the subject lies on his stomach. Autopsy appearance. In addition to signs of asphyxia, mud or other foreign material on clothing, as the case may be, character features deep cyanosis of face and numerous petechiae. A demarcation line. A mechanism is as follows: compression of the chest displaces blood from the superior vena cava and subclavian vein into the veins and capillaries of the head and neck. No valves are present in a superior vena cava because because back pressure is normally not present in venous system above the level of the heart. Valves in a subclavian vein prevent spread of the hydrostatic forces set up in the blood column to the veins of the upper limb. The valvulus veins and capillaries of the head and neck are therefore considerably engorged, and hydrostatic pressure in them rises so rapidly as base their walls. Therefore, the face and neck of the victim are deeply cyanosed, almost black. The eyes, bloodshot, and numerous petechiae are found over the scalp, face, neck, and shoulder. The level of compression is indicated by a well-defined demarcating line between the discolored upper portion of body and lower normally colored part. Traumatic asphyxia sustained by a running over an accident. Level of compression is indicated by a well-defined democratic line between the discolored upper portion of the body and lower blood part. The face is deeply cyanosed. In mild cases of traumatic asphyxia, injury to the lung may be in the form of traumatic emphysema, wherein the air in the lung is forcibly and distributed, producing small bullae along the edges of the lung. Depending upon the mechanism of trauma, other injuries may be found in other parts of the body. Severe cases, injuries to the chest include fracture of the rib, which are usually bilateral, multiple, and at their angles, with occasional damage to the diaphragm, injuries to the lungs and heart. Medical legal aspect. This is mainly an accident because which can be homicidal, as in barking, manslaughter, which is rare. Rarely an obese mother sharing the same bed may roll over a child in a sleep and cause death of the child from traumatic asphyxia. Bansadola is a homicidal compression of the chest by means of bamboos or bamboos. It is not common nowadays. Thank you.